Imagine walking into your patient's room to find a sustained, terrifying monitor alarm. The heart rate is sitting at a deadly 35 beats per minute. Blood pressure is 70/40. The patient is barely responsive, sliding down the bed in profound cardiogenic shock. I'm Brooke Wallace. With 2 decades as an ICU nurse, I created Super Nurse AI to bridge the gap between intimidating textbook theory and real, messy bedside care. Hit subscribe because today we are dissecting how to manage and prevent massive cardiac medication overdoses. Managing a crash requires mastery of the daily clinical practices that prevent these emergencies from happening. This checklist represents the mandatory thresholds for administering a beta blocker. You must verify the heart rate is above 60 and systolic blood pressure is greater than 90. The gate only opens once those thresholds are reached. These medications limit the heart's ability to compensate for movement. As a patient stands up too quickly, gravity pulls blood towards the feet, but the heart cannot beat faster to push it back to the brain. We must teach patients to change positions slowly to prevent orthostatic hypotension and falls. If a patient abruptly stops their medication, they trigger a rebound effect. This diagram shows receptors that were previously blocked suddenly becoming exposed. Adrenaline and stress hormones flood the system, slamming into the heart and triggering a lethal arrhythmia or a myocardial infarction. Adhering to these parameters and providing clear discharge education is the first line of defense against a cardiac crisis. When an overdose occurs, the timeline is often deceptive. With extended release formulations, a patient might appear stable for hours, while the actual hemodynamic collapse is delayed for up to a full day after ingestion. Size also dictates the toxicity. In pediatric cases, ingesting just a single beta blocker or calcium channel blocker pill can throw a toddler into fatal cardiogenic shock. A massive dose zips the heart's communication receptors shut. This silent mode halts the electrical pacemaker and weakens the physical squeeze, dropping the heart rate and blood pressure to critical levels. This side-by-side comparison reveals the primary diagnostic trap. The ECG trace for a beta blocker overdose on the left and a calcium channel blocker overdose on the right are identical. On a standard cardiac monitor, the visual data looks exactly the same. Relying solely on the monitor makes it impossible to identify which specific medication is killing the patient. To differentiate between the two, we have to look away from the heart. Pause the video now. Which 2 non-cardiac assessments will confirm if this is a beta blocker or calcium channel blocker overdose? Beta blockers block liver receptors, preventing glucose release, causing profound hypoglycemia. Conversely, calcium channel blockers inhibit insulin from the pancreas, making glucose levels rise, causing hyperglycemia. Finally, fat-soluble beta blockers cross the blood-brain barrier, triggering lethargy, coma, or seizures. If a crashing patient presents with seizures and low blood sugar, you have confirmed a beta blocker overdose, which fundamentally alters the treatment path. Exceptional nurses treat the entire interconnected physiological system rather than reacting to isolated numbers on a screen. This framework locks in the core rules. Quadrants 1 and 2 cover our baseline safety. Always clear the heart rate and blood pressure thresholds before dosing, and warn patients that stopping the medication abruptly can be fatal. Quadrants 3 and 4 focus on the overdose. Stay vigilant for delayed crashes with extended release pills, and remember the 1 pill kill risk in children. Finally, look for hypoglycemia and seizures to confirm beta blockers and hyperglycemia for calcium channel blockers. Hey, thanks for watching my YouTube channel. Don't forget to like and subscribe and leave a comment. Let me know what topics you want to see more of and how I can help you become the super nurse you were born to be. I hope to see you here again real soon.